My name is Dr. Mutuma. I want to talk about cancer of the brain. Cancer of the brain is one of the common cancers which have, and cancer of the brain, actually, we normally remember people with cancer of the brain in this month of May. Cancer of the brain nowadays is rising and normally common in both men and women, but you find that there's a bit of higher percentage in women. Cancer of the brain, it affects both the children and the adults. This is mainly bimodal. Bimodal means that it affects the young children and also affects adults. Now, cancer of the brain, the first thing is signs and symptoms of cancer of the brain. Cancer of the brain, the most important sign of cancer of the brain is acquired headache which does not disappear with taking drugs. The other signs of cancer of the brain is vomiting, which we call it projectile vomiting, especially vomiting in the morning. And other signs of cancer of the brain is having fits of epilepsy. If you didn't have epilepsy before, you start having fits. And one of other signs of cancer of the brain is when you start having problems in sight. And in fact, people actually have problems in sight. They become blind because of cancer of the brain. And the other problem is walking or gait. You find that you have been walking properly, but now you are walking and walking is not very stable. That means that your brain must be having problem. So once you have those signs and of walking, of sight, of smell, of vomiting in the morning, especially for children. When you find your child is vomiting, especially in the morning, it's good at least to be checked. Now, when you've got these signs of cancer of the brain, what you do, the first thing to do is that cancer of the brain is not screenable. It's one of the cancers which you cannot be screened for it because the screening will be very expensive and not very necessary. It's common cancer, but not very common as the rest of the cancers because I think in adults it's cancer number 12 in Kenya. And of course, in most of the countries, is not within the 10 commonest cancers. Now, so cancer of the brain, I've talked about the signs and symptoms, what to do with it. Suppose you have got those signs, what's the first thing to do? You have got headache, poor vision, you're not working properly. And then sometimes as you start having fits or epileptic fits, which you are normal, and then you start having falling down. What do the first thing is to see a doctor, and the first test which you do to diagnose cancer of the brain is not X-ray, is actually you do CT scan of the brain or MRI. Those are the first important tests which you do when you've got cancer of the brain. Cancer of the brain, as you know, that is that the outcome is not very good. So the earlier the diagnosis, the better. Now, we normally say that cancer of the brain, but cancers of the brain are so many. We have the commonest is gliomas. There are medulloblastomas, and there are so many tumors, so many types of cancers of the brain, but mainly that's for academic purpose. For general purpose, just know that cancer of the brain. Cancer of the brain is a swelling in the brain. And as we know that brain is a sender, or actually is what controls everything. So once you've got cancer of the brain, you have got a lot of problems, and that's why the outcome and also complications of cancer of the brain are quite major. Now, what we are doing, especially here in Cambridge, we are going to look at cancer of the brain because we have seen that cancer of the brain is common. So we're going to do a research on cancer of the brain, check what's happening, what has happened, what is the age, what can be able to increase the survival rate of cancer of the brain, because survival rate of cancer of the brain is very long. Now, once you have cancer of the brain, you have made the diagnosis. What's the next now? The next important thing is the treatment. Treatment of cancer of the brain, and these are most of the cancers. The first thing you need to do is actually, if it's resectable, you can be able to do a surgery and remove that tumor, or sometimes, if not resectable, you do the chemotherapy and radiotherapy. So treatment of cancers of the brain are normally not very easy because, as you know, brain is a tissue which is very soft. It's not, brain is like liver. Brain is not like lungs. It's very soft, and sometimes operation can be very tough and also not very cheap. And then you find that actually the radiotherapy and chemotherapy of the cancer of the brain, because of other factors in the brain, is not very easy. So basically, cancer of the brain is not very easy cancer to treat, but it's treatable. And most of the times, as I've said, cancer of the brain actually they present at very late. And the staging of cancer of the brain, we know cancer, they stage from stage 1 to stage 4, but cancer of the brain are a bit complicated because most of them are actually they present as stage 4, because by the time you have signs and symptoms, the cancer is quite big. Now, There is primary cancer of the brain. Those are the cancer which originate from the brain. But there are some cancers which are secondary, which start from somewhere in the body and they move to the brain. We call it metastatic cancers of the brain. And this mainly from cancers can metastasize from the breast, from the lung, from the esophagus, from the stomach, from the liver to go to the brain. And those are different. That's why sometimes when you've got any cancer from any part of the body, it's also good to do CT scan to confirm if the cancer has gone there. So basically, cancer of the brain is a serious cancer and it's becoming quite common. We don't know why, but we believe because of radiation, which is becoming quite common nowadays, and also other factors like genetic factors, which we are going to check if there's now it's good to look at our research and confirm if cancer of the brain becomes common because of genetic mutation, because some of the cancers are genetically inherited, and that's why we have got some few symptoms in medicine where when you have them, you normally proceed and have cancer of the brain because of that specific gene mutation or gene translation, which actually is quite common for people to have cancer of the brain. So to end this talk is that it's good to be aware of the signs and symptoms so that becomes quite easy when you can be able to be treated early, and treatment is always better when cancer is treated early. Thank you very much.